You might be sitting here thinking, well, that's nothing new. Damage control pre-hospital care. Yeah, we all know about damage control care in trauma. What are you going on about? The point is doing the minimum necessary. And I think if you reflect on that case that we said was horrible, where we got stuck with someone trying to do all these interventions and they died with us on scene when they might have been able to make it to theatre in that time, you've got to question what you're doing. And I have to question it, and I'm like one of the leads for training Rabo and all these fiddly interventions. And we have to change tact. And I think the simplest way to describe damage control pre-hospital care is this saying that many of you might have seen. It's an old prayer. My mum used to have it, carry it around everywhere she went because we were driving her mad. But it says, God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. It's a thing called the Serenity Prayer. The point is, it's about recognising, can I control this problem in front of me or can I not? And if I can't, I need to be wise enough and grown up enough to say, I can't control this, I need to go. And I might need to be ballsy and do stuff en route. So this case was a young lad, again, tragically, shot with a shotgun really close up in the back of the chest, a couple of times by the looks of it. There was a massive crowd. When a colleague of ours, Dan, arrived with him, he was peri-arrest. He looked awful. The description sounds like someone who is literally about to die at your feet. There was a crowd around him. So I think push came to shove and he actually had to get out there anyway, physically. But also he felt clearly this was chest pathology. And he felt there was no pathology in the abdomen or anywhere else for that matter. In fact, his description was he could fit his fist into the chest of this boy and feel to the point where he went, oh, hang on, I shouldn't really go any further than that. Something bad is happening here. So you're faced with this person who is dying and has this massive hole in the back of their chest. What are you going to do? Do you want to do anything to him on scene? What's in there? What's in his chest?
Yeah, maybe I'll just try to put my hand into the chest and compress the aorta and then make a run for it.
Well, good point.
Already.
Depends where the hole is. I think that hole was more on the right than the left. But I think the feeling was it was just mush and we couldn't tell what was going on and he didn't want to push any further. The point I think I'm making is that we don't know what the hell is in there. And I can pretty much guarantee you, if I go in there and try and control it with a thoracotomy, I'm not going to have as much luck as Zane or any of his surgical colleagues. I really, really, really want to be in hospital with this kid. So what the team did is what I now hope I would do, and this is what we're describing as damage control pre-hospital care, and which led this lovely young boy to be able to come up, stand here with his mum on Dan's birthday and take a picture. They put in a line. In fact, he just put the wire of a subclavian. I know that's very controversial. I shouldn't say that, but that's what he did, and carried it on en route, held onto it and carried it on in the ambulance, or as the ambulance was leaving, filled him with blood and just ran to hospital. He decompressed his chest on the way, didn't put chest drains in, 2 holes, let the tensions out. There was tensions both sides, chest seals on. We ain't got time for chest drains. There's too much going on. Filled him with loads and loads of blood, ultrasounded him to know that there was no tamponade, that he was fast negative in his abdomen, and it turned out, it's bloody lucky he did all that because he had a hilar injury and he needed a thoracotomy by someone who knew what they were doing. And I've done a lot of thoracotomies and I would say I'm not someone who wants to deal with that. So that's what we're describing by damage control pre-hospital care. Now, I will just flick through to say that when they're stabbed all over, and that's what I was faced with last week, and when the pathology is not so straightforward, it can be a bit perplexing. And you just have to be really careful. You have to do all the stuff we've talked about. Be careful, look at the physiology, look at the trends, look at the anatomy, work out what you think is going on, and is it right to run to hospital with this patient? Do we do it in blunt trauma? We've pretty much decided, I mean, this is really very recent, in the last few months, we've written some stuff down about this. We've decided we're quite likely to get it wrong, and we actually think we might have got it a bit wrong a couple of times. Not wrong, but it's easy to miss a pneumothorax, much easier to miss a pneumothorax in blunt trauma. It's easier to get the diagnosis wrong in multi-poly blunt trauma. And I think only if it's very, very clear, like, for example, this lady I treated years ago who had a clear lorry only over pelvis. Now, she got a balloon, but if I couldn't get a balloon in, you could argue if she needs a chest opened, opened it. If she doesn't, just run to hospital, because there's nothing else here I need to treat. Her airway doesn't need managing, her breathing doesn't need managing. The only problem is exsanguination. And I don't want to end up in her chest. The point is still the same. We haven't changed anything that we're teaching you. We're just saying that there's a different tact if you look at the patient as someone with a failing heart and a failing brain, and you can't control the problem, you have to run. And you have to do stuff en route. And we've all learned, actually, we thought it'd be really hard, but you can put art lines in en route, you can put subclavians in en route, you can do a hell of a lot of stuff en route. Chest seals are not that bad. Little slug of ketamine if needs be to tolerate them. You can do a lot of stuff en route to hospital.